What if I told you that surgery didn't begin in Europe? It didn't begin in Greece, and it didn't begin in modern hospitals. What if I told you that the world's earliest known surgical tools were discovered in Africa, thousands of years before modern medicine even existed? No electricity, no anesthesia, no textbooks. Yet African healers were opening skulls, setting bones, and performing life-saving operations, and patients survived. This is not myth. This is archaeology. And this is a story history rarely tells. When people think of ancient medicine, they usually think of Hippocrates' Rome or medieval Europe. But long before those civilizations rose, Africa was already experimenting with the human body, not recklessly, but with precision, knowledge, and purpose. Across regions like ancient Nubia, Egypt, East Africa, Central Africa, archaeologists have uncovered surgical tools and human remains that show something shocking. Let's start with the most important evidence: human skeletons. In multiple African burial sites, scientists discovered skulls with perfectly circular holes. At first glance, this sounds horrifying, but here's the twist. These skulls show clear signs of healing, which means the patient survived the surgery. The bone began to regenerate. Infection was prevented. This procedure is called trepanation, a surgical operation where a portion of the skull is carefully removed to relieve pressure. And Africa contains some of the oldest trepanation evidence in the world, dating back over 7,000 years. That's thousands of years before similar evidence appears in Europe. Now let's talk about the tools. Archaeologists have uncovered stone scalpels, sharpened obsidian blades, bone and copper instruments, polished surgical knives. These weren't random sharp objects. They were carefully shaped, repeatedly used, designed for cutting flesh cleanly, not tearing it. Obsidian, for example, is sharper than modern steel. Even today, it's used in experimental surgical scalpels. Ancient Africans understood this thousands of years ago. One question always comes up: how did they manage pain? The answer lies in African botanical knowledge. Ancient African healers used natural anesthetics, sedative herbs, antiseptic plants. Some plants used traditionally in Africa are now known to contain pain-reducing compounds, anti-inflammatory agents, natural antibiotics. In fact, modern pharmacology has confirmed that many African medicinal plants actually work. This wasn't guesswork. It was trial observation and generational knowledge. These procedures weren't performed by random individuals. They were done by highly trained healers, medical specialists, spiritual physicians who combined anatomy with belief systems. In many African societies, medical knowledge was closely guarded. Training took years. Mistakes were not tolerated. Surgery was seen as both a science and a sacred responsibility. African surgeons didn't open skulls for curiosity. They treated head injuries from war or accidents, severe headaches, epilepsy, swelling and pressure in the brain. In some cultures, surgery was also believed to release evil spirits, but the medical results were real regardless of belief. Patients survived, and survival is the ultimate proof. Here's the uncomfortable truth. When African surgeons were performing successful operations, many other regions feared opening the body, considered surgery taboo, had higher death rates. In medieval Europe, surgery was often done by barbers, with no antiseptics and little understanding of infection. Meanwhile, African medicine emphasized clean tools, herbal treatment, post-operation care. The idea that Africa was medically primitive simply does not survive the evidence. So why don't we hear about this? Because colonial history downplayed African science, rebranded African knowledge as primitive, credited discoveries elsewhere. African medicine was dismissed, ignored, or erased from textbooks, not because it didn't exist, but because it challenged a narrative. The earliest surgical tools were found in Africa. That means Africa didn't just give birth to humanity. Africa also helped humanity survive. Before modern hospitals, before white coats, before microscopes, African hands were already saving lives. History didn't begin elsewhere. It began here. And the more we uncover, the clearer it becomes. Africa was never behind. It was ahead and interrupted.